This video is intended to train healthcare professionals how to use the one-step HBsAg whole blood rapid test. The Bioline HBsAg whole blood rapid test is an in vitro immunochromatographic one-step assay designed for qualitative determination of HBsAg in human serum, plasma, or whole blood specimen. These components are included in the test kit. These components are required but not provided. Kit storage and stability. The Bioline HBsAg should be stored between 1 degree Celsius and 40 degrees Celsius. Do not freeze the kit. The test device is sensitive to both heat and humidity. Perform the test immediately after taking out the test device from the foil pouch or container. Do not use the test kit beyond its expiration date. The shelf life of the kit is as indicated on the outer package. Do not use the test kit if the pouch is damaged or the seal is broken. Here are some important warnings before you begin. Bring kit components and specimen to room temperature. Remove the test device. Dispense 100 microliters of serum, plasma, or whole blood specimen into the sample well. As the test begins to work, you will see a purple color move across the result window. Interpret test results at 20 minutes. Interpretation of results. A purple control band will appear in the left section of the results window to show that the test is working properly. The right section of the results window indicates the test results. Negative, the presence of only control band C within the results window indicates a negative result. Positive, the presence of the test line T and the control line C within the results window, regardless of which band appears first, indicates a positive result. Invalid, if the control band C is not visible within the result window after performing the test, the result is considered invalid. Instructions may not have been followed correctly or the test kit may have deteriorated. It is recommended that the specimen be retested using a new test device. Test limitations. A negative result does not preclude the possibility of infection with HPV. Other clinically available tests are required if questionable results are obtained. As with all diagnostic tests, a definitive clinical diagnosis should not be based on the results of a single test but should only be made by the physician after all clinical and laboratory findings have been evaluated.